So here in Great Western Hospital, we're going to be educating medical students in virtual reality. So what we can do is have students put on this virtual reality headset and it transports them into a virtual world where they're almost in a simulation suite. They can investigate the patient, they can do observations, they can treat the patient and hopefully identify the early signs of conditions like sepsis. And currently we're working with a company called Goggle Mind to introduce this into the Great Western Hospital in Swindon, and we're also working with the Sepsis Trust. This is an organisation who's helping us deliver and co-develop sepsis education to the wider education of healthcare professionals. We're using high fidelity simulation in the immersive simulation world. This is transporting students into a virtual reality experience which is being evidence-based with Bath University. So in the normal simulation environment, you'd have the mannequin and you'd be with the patient on the ward and you'd be interacting with the patient using all the investigation. However, we don't need a room that costs almost upwards of 300,000. We can do it all in a headset. So all you need to do is put on the headset, grab your controllers as hands, and you're controlling yourself in the room and interacting with the patient as if you're there. So we're working with Goggle Minds here. This is a co-development strategy whereby we're hoping we can continue to develop simulation quickly, and this is allowing us to adapt it to the needs of our students. The important thing about having a good relationship with a company is that NHS doesn't always have access to upfront cutting-edge technology. And by developing systems with an established company, we can support them in producing up-to-date, evidence-based simulation that helps teach healthcare professionals, not just here on the Trust, but we want this to be wider, and that's why we've got involved with Sepsis Trust as well, to ensure that we can educate people beyond these walls. So Dr. Holt, you've been just using the virtual reality simulation. Can you tell me a bit about that?
Yeah, so it's quite a realistic setup. The room that you're in is sort of based on an actual hospital emergency department resuscitation room. It certainly has that feel. You can do most of the things that you would want to do in real life in there. So there's a sink you can turn on and wash your hands. There's gloves next to it. You can pick up a stethoscope and listen to people's heart sounds and lung sounds. You can get all of the standard observations that we'd want to determine how sick somebody is. There's quite a lot of stuff in there that really does sort of simulate what you're doing in actual clinical practice.
And do you think you can learn from that?
Yeah, absolutely. So I think a lot of what we do with our medical students is it gives them a chance to experience things that they otherwise wouldn't be in a position to experience as a student. So as a student, typically you can go along and watch other people do things, but for safety reasons we can't let them do a lot with patients themselves. The good thing with these simulation scenarios is that you can get them acting in the role of the doctor. It's safe for them and for the patient, and then it ends up that you can have conversations with them that you wouldn't otherwise have been able to have if you'd just been talking through something with them or getting them to read a textbook.
That's great. So it's got a real wide, user base, and we can use this for lots of different healthcare professionals, whether they're in training or qualified. And I believe you can even have multiple players in a room.
Yeah, so at the minute you can do it a couple of different ways. So you can either have two people doing the exact same scenario at the same time, sort of in the same virtual room. Often what we do is we get our students doing the same scenario but sort of side by side on different headsets. So they're both working independently and they both get the experience of sort of flying solo, if you like. But at the same time, we're able to cast the images from one of the headsets onto a display. So you can actually teach larger groups still, and people can still follow what's going on.
And as we know, debrief is really important. Does that mean you can debrief as a group then?
Yeah, absolutely, because everybody's been able to follow what's going on. And actually, one of the interesting things we've found about this is when we've talked to our students who have done both virtual reality sim and a simulation suite sim, often in the simulation suite they're acutely aware that all of their peers are watching them on the cameras and it makes them quite nervous. There's something about putting on a VR headset that means a lot of them get really sort of immersed into it, and they say it feels less like they're being watched, and so it's more comfortable for them as well.
Less anxiety, improved learning.
Yeah, absolutely.